So first, tell us the difference between seizure and epilepsy. A lot of people use it interchangeably. Oh, he has epilepsy, he has a seizure. We think pretty much in the same terms. But is there a difference between seizures and epilepsy? When do you call it a seizure? When do you call it an epilepsy? Because you're an epilepsy specialist, so now we are getting into your wheelhouse.
Okay. Yes, they are different. It's the same thing, but the difference is that, for example, if you have a single isolated event, and it's like a proper seizure, or which could be generalized tonic-clonic seizure, or it could be the stirring episodes or whatever type of seizure. So if it's a single episode, we call it like a seizure, like a single seizure. Even if there are two seizures within the same day, within 24
Mm,
hours, we still call it seizure. We don't call it epilepsy.
I see.
So the term or the label of epilepsy comes if you have or someone has two or more seizures more than 24-hour apart. Only
I
then, and
see.
they have to be non-provoked.
Hmm.
So here's the question. The question is that, can a normal brain have a seizure?
Hmm.
Answer is yes. A normal brain can have a seizure in situations of, for example, fever, in situations of electrolyte imbalance. If you have like low calcium level, sodium level very low, or magnesium level very low, you can have a seizure. In case of trauma, like, you can have seizure. In case of low blood glucose, in our the people who have diabetes, they can get
Yeah.
seizure just because of the low blood glucose, but that doesn't mean they have epilepsy.
So epilepsy would be when when you keep having seizures without any obvious reversible causes. Is
Correct.
that right?
Yes.